Hello, everyone. Thank you for attending this session. Today, I'm excited to share an interactive teaching strategy called Neuro Circus. It is a high-pressure branching simulation designed to help nursing students strengthen neurological prioritization and clinical judgment. This activity was really developed to address a common gap that we see in students' ability to really recognize the subtle but critical changes, especially those related to airway compromise. So sit back and enjoy the show. All right, but before we get to the fun stuff, let's back up a little bit and let's look at the problem here. So many of us experienced that students can recall neurological conditions, but they really struggle in that application of knowledge in real-time decision making. What we often see is difficulty recognizing the subtle deterioration, particularly in the neuromuscular conditions where that respiratory decline is not immediately obvious. Students may also focus on what looks dramatic rather than what is most dangerous. So this creates a gap between the knowledge and safe clinical prioritization. When deciding what to do to address the problem, I looked into a lot of different resources. The purpose of this activity was really to move beyond the memorization and really more into that clinical reasoning. We wanted students to practice prioritization under pressure, recognize those patterns rather than diagnosis, and most importantly, identify the early signs of airway compromise. Their goal is to simulate the kind of decision-making they will face in real clinical environments when they're at that bedside practicing. You also want to make it fun and memorable for the students to help it stick. I had circus music playing for the students during the activity. I also brought in popcorn since we were at the circus, and I myself dressed as a ringmaster to portray the role throughout the activity. Before we jump into the development and the step-by-step process for this activity, I want to just take a moment to run through the concept of EscapeIF. This was really developed by Dr. Scott Nicholson, who is a professor of game design and development at Wilfrid Laurier University, and he describes his game system as taking interactive fiction and storytelling concepts, using them to help teachers develop escape room type experiences in the classroom. So these collaborative storytelling games are specifically designed really to be low resource, and that makes them easy to develop and implement without really that need for expensive equipment. When each of these EscapeIF games are created, the teacher really only needs a script to read from during the activity, and that script is going to offer those choices to the student about what to do next in the story. Similar to a choose your own path. So the students will then solve those problems and challenges in order to move on and finish the game. The challenges that they experience are related to what they are currently learning in class, and this helps really to test the student's skill in that topic. The games are meant to be as accessible as possible, and they're available on, I've included here the site that you can visit to get lots of free resources from Dr. Nicholson to help create your own EscapeIF. They are adaptable to really fit your lesson plan. He offers also those creation guides to help you make your own games and a way to work through your design process. In Neuro Circus, students enter a fictional performance setting where each performer represents a neurological condition. Rather than being told the diagnosis, they are given subtle, sometimes vague symptoms, and then they have to decide who to assess first. Each decision leads them down a different pathway with new information revealed. And I've included here a picture of how I set this up using just PowerPoint. And the ringmaster costume. So the design of this Neuro Circus is intentionally structured to increase that cognitive demand. So symptoms are subtle, not necessarily textbook. And as students make decisions, additional assessment findings are then revealed to them. If they prioritize incorrectly, time passes and the patient conditions worsen, which mirrors what happens in the real clinical setting when early signs are missed. What helped me a lot when I was developing this activity was a map of the different branches for each decision that the students made. And this really provided a good outline for putting together the PowerPoint and trying to keep things really straightened out and interconnected, as you know, when you branch off, and then, coming back together. That was probably the biggest hurdle for me to overcome when putting this activity together. So this just shows an example of mapping that I found helpful when I was developing the Choose Your Own Path activity. It really helped me visualize the pathways, and it was useful when I developed those PowerPoint slides. This only shows about half of the branching map that I utilized. I had 2 decision points in my activity, but it gives you a good idea of kind of where I started when I mapped things out. The core clinical focus is really on that early respiratory compromise with these neurological patients. We emphasize subtle signs such as weak cough or fatigable speech, decreased breath count. These are often overlooked because they don't really come across as dramatic. They are critical indicators of potential airway failure, so they are important to recognize and to recognize early. With this activity, I really looked to incorporate those timed decision making to create that sense of urgency. So typically 30 seconds for those initial choices and then 20 seconds during those crisis scenarios. There are built-in time lost consequences in this activity. There's also a final crisis that requires that rapid prioritization, and even a surprise performer that comes in with a neurological flair to further challenge students and their assumptions. Importantly, this can all be done in a standard classroom without any high fidelity simulation equipment, really done, like I said, just using PowerPoint. This slide shows an example of that time lost that I had alluded to in the previous slide. So when the students chose a mild or moderate patient to assess further instead of the high risk, then they would have to complete an additional activity to kind of simulate that time lost on that chosen performer. This time lost activity was a matching where you had the conditions and you had to match them with the priorities within each condition. It simulates that time lost, assessing again the mild or moderate risk performer instead of the high risk performer. And when they complete this time lost activity and then go back to assess all of the other performers, we now have symptoms that have worsened in nature and more of that respiratory compromise in some of those high-risk performers. And looking then at the student experience regarding this activity, students consistently report that high engagement with this format. They really felt the pressure of the decision making, which leads to deeper emotional and cognitive investment. They also experience the uncertainty and cognitive overload, but in a safe environment. And that's really critical for building real-world readiness as they practice at the bedside caring for people's lives. So on this slide, I really wanted to show you what my PowerPoint for the activity looked like. So we first start with the opening and the circus music, the crisis under the big top, and then we move into meeting the performers. So we click on each one of the performers, like the magician or the lion tamer, the acrobat, the tightrope walker, the mime. And as we click on them, I provide very vague assessment information. Once we have gone through each performer and the students as a class have been given the vague information, they decide which one to perform a more thorough assessment on. After choosing that performer to do a more thorough assessment on, I then provide more details and they decide the next steps. But when we get to that part, and they're deciding the next steps, that is when the surprise performer appears to make the situation more tricky. Now they must decide what to do, who to assess or care for immediately. And this is just a slide of the lion tamer where if they chose that, I would click on it and it would take us to this slide and I would provide more thorough assessment details on it. And then I would give them a multiple choice NCLEX style question where we would discuss what you would do next. In the middle of them deciding that is when we would come with the surprise performer, that neurological flair, if you will, where now we've got another component in this decision. And what do you do now? Do you stick with what you've chose, or do you maybe change your decision to a different performer? We all know how important that debrief is, right? It is where the learning is absolutely solidified from the experience. So for the debriefing, we really focus on the emotional processing. Once we've done that, we move into the clinical reasoning. We discuss common cognitive traps, like focusing on the dramatic but not life-threatening symptoms, and then reinforcing the importance of airway prioritization and pattern recognition, and then connecting these decisions directly to NCLEX style thinking. Outcomes, our desired outcomes, and then kind of while this is still being evaluated, that initial implementation, it really has shown strong outcomes. Students demonstrate an increased engagement, that improved confidence in prioritization, which we know these students really need a lot of exposure to and practice with, and also better recognition of those subtle respiratory decline symptoms. Perhaps most importantly, they begin to shift from memorizing conditions to really thinking clinically and critically. As far as looking at the implementation of the activity, I would say one of the strengths of this activity is the accessibility of it. It can be completed in about 1 hour using a PowerPoint with those branching slides. You could have a student worksheet. I did not opt for that, but in the future, maybe that might be something that I do include. And then the facilitator guide to just help with ease and flow of the activity to keep it moving. It's flexible. It can be adapted for different class sizes or even levels of complexity depending on where the students are. I did do it in 1 hour of class, and we did it as an entire class as a whole where they discussed and made their decisions. Depending on how big the class is, this can be difficult because of that time constraint that you want them to have to feel that urgency. So when the class is big, you might look at having different groups and maybe boards or dry erase boards or some kind of signal with their decision. It would be confusing, maybe majority rules in that aspect where you pick the path or everybody picks their own and then they go down different paths. That's something also to experiment with. Looking at the big takeaways, I would say the biggest is that subtle symptoms can signal critical decline. Students really have to learn to prioritize that airway risk over visible or more dramatic findings that might lead them astray. Clinical judgment is built through practice, and active learning strategies really help um, bridge that gap between knowledge and application. In closing, I'll leave you with this. In neurological patients, deterioration often whispers before it screams. Our goal is to help these students recognize those whispers early so they can act before a crisis occurs. And I do think that this activity really helped to build that bridge for them and get them to recognize those whispers and that time constraint to work through it and that decision making and prioritization. Thank you very much for your time, and I hope this was helpful to you.